Hello everyone, welcome to this series, this lesson in the broiler production demonstration class. Today we want to talk about medication for broilers. I'll be showing you what medication to give at what time. I'll also be showing you how to administer liquid drugs. I'll be showing you how to administer water-soluble powder drugs as well. We'll be demonstrating the use with our syringe and with our weighing scale. Now, I would like to start by saying that if your birds are few, you are just keeping 3, 5, 10 broilers, you can afford to keep them without giving any medication at all. But if you are raising birds on a commercial scale, you are raising more than just a few, you must necessarily give drugs because the birds we have are species that are not adapted to our diseases and our climate. And so if you have them here due to their low resistance to disease, they will fall sick. You cannot afford to risk your investment. You must give drugs. Now, there are two extremes, no drugs and too much drugs. We are not supposed to fall to the no drug, no medication extreme or the excessive medication. Some farmers that I know, from day one till the day they sell off their birds, the birds are constantly on drugs. That is a very, very wrong practice. It's not only harmful to the birds, it's also harmful to the consumers that will eat that bird, that chicken, when it is ready. So we must learn to do it correctly and rightly. Now let's talk about our schedule, our chart, what drug to give at what time. There are 3 drugs that are really, really compulsory. And they are the ones that form the basis of any chart. Number 1, prevention drugs for Newcastle disease. Number 2, prevention drug for infectious bursal disease. Now, number 3, prevention drugs for coccidiosis. The prevention drug for Newcastle disease, most times people call it Lasota. Lasota is a strain, a type of the prevention drug. So we also have Gumboro, which is infectious bursal disease, Gumboro vaccine. And then we have our coccidiostats, which are used to prevent coccidiosis. Now, your Lasota and Gumboro that are diseases, are vaccines for preventing viral diseases, I should say that the right way to determine when to administer them is to take your birds, a sample of the blood of your birds, to the lab to test. Now, if you draw out a sample of blood and you take them to the lab will carry out a test, antibody test, to know the amount of immunity your birds have acquired from their parents. That immunity, they will also know when it will elapse, when it will finish. It is at the end of that time that, or towards the end of that time, you are meant to administer your drugs. That is your vaccines. This lab test will now give you will give you a chart. Okay, on day 5, your Gumboro, or what do we call it, infectious bursal disease immunity will expire. So give them the new vaccine on day 3. Your Newcastle disease immunity will expire on day 17. So give them their first Lasota vaccination on day 12 or 14. But when you don't have these details from the lab, any other thing you are doing is guesswork, wide approximation. So whether you do Gumboro first or you do Lasota first, it doesn't matter if you are approximating. If you are doing trial and error, it doesn't matter whether you do one on day 7 or day 14, you are just guessing. Now, if you cannot afford to take chances with your birds, and your birds are too few, or you don't have access to facilities that will take this lab test for you, then the best and safest option is to follow the designated and recommended chart that is released by the hatchery you are buying from. If you are buying from Chi, for instance, CHI, they have their recommended chart. If you are buying from Agritech, they have their recommended chart. These hatcheries have their recommended chart. Look for those charts and follow them. They are charts that have been drawn from experience of how the lab results that they have in over time, that made use of those lab results and have used the chart and prepared the chart that they have been using for their own experimental farms. Those charts are the best option you can use if you want to go for trial and error. Now, a few of these companies will have their chart at the bottom of the carton. Check on the body of the carton. You will find some of them printing out their charts on the body of the carton. Other ones have it readily available. If you make requests, they will give it to you. I hope the issue of chart is cleared now. Now, on that chart, you will most likely not find any antibiotics on it. They will only give you the medications you should use against viral disease, that is vaccination. As for medications for other things, your coccidiosis, we are done with Gumboro and Lasota now. Your coccidiosis vaccine, and treatment, prevention, is best done a few days before week 2. Now, if you keep your environment neat and tidy, you have cleared everywhere, you cleaned everywhere, you don't have, and you keep your environment dry. Dry is very important. Water is not spilling everywhere, and you're having damp floor and all of that. If everywhere is as it's supposed to be, you don't have any fear of coccidiosis before week 2. So when you are getting towards the beginning of week 2, let's say day 12, day 11, 12, 13, before you get to day 14, you can begin to administer your coccidia intervention. So on day 12, 13, 14, you can give your coccidiosis prevention, and it will come in just fine. If you want to be on the safe side, start from day 10 so that you finish before day 14 actually meets up with you. I hope this is clear. Now, one major disease that disturbs a lot of farmers in Nigeria and several other African countries is the issue of respiratory issues, respiratory distress, CRD, chronic respiratory distress, catarrh, cough, that is how we call it. It disturbs farmers a lot. Now, catarrh and cough can start even on day 2. The triggers that make that issue occur are stress. If your birds are excessively stressed in their journey, catarrh, cough can start even on day 2. If your environment has smoke, has dust particles, your birds are stressed in your environment, these can break out at any time. So you're on the safe side, also preventing chronic respiratory disease. That is where the issue of brooding drug comes in. Your brooding drug is the one you use to prevent what you anticipate may occur to your birds. So your brooding drug can start on day 2 of the life of your birds, can start on day 3. Many drugs will be administered for 3 to 5 days. If you start on day 3, for instance, you give them day 3, day 4, day 5. If it's a 5-day drug, day 3, 4, 5, 6, 7. So there is no fixed rule. It's depending on the particular drug. If it's a 3-day drug, 3 days. I hope this is clear. So that is where your brooding drug comes in. Now, let's look at how to administer drugs. Every medication you pick has instructions on the body. It's written here clearly. It's just for you to read. Pick up any medication you have, whether you are going for the powdered ones in sachets. There are instructions written here. Whether you are going for the liquid ones, there are instructions on it. Pick it up and read. If you read it, you will find dosage and administration. You also find what the drug is supposed to treat. This is fluoxetine. Fluoxetine is an antibiotic that treats CROD, colibacillosis, fowl cholera, fowl typhoid, and other salmonella infections. So this is it. If you look at the dosage administration, there is administration for poultry. It said we should add 15 ml of fluoxetine to 200 liters of water. 15 ml to 200 liters. If you do a quick calculation, you will find if 15 ml goes to 200 liters, 5 ml will go to 20 liters. 5 ml. What we mean by ml is milliliters. Milliliters. If you pick a syringe, this is a syringe, we use it, call it injection. You pick a syringe, you will find that ml is written on the body. This syringe I have is a 2 ml syringe. So based on the numbering here, you can pick out 5 ml if you are giving your birds up to 20 liters. If 5 ml goes to 20 liters, it means 1 ml will go to 4 liters. I hope that calculation is very straightforward. 1 ml goes to 4 liters. Very basic calculation. So if 1 ml is going to 4 liters, you are using a 4-liter drinker. You open your medication. Open your medication, tilt it. Put your syringe in and draw out 1 ml. There is air in this. I'll push out the air. I have one just slightly above 1 ml. This is still fine because of the air bubbles. So this 1 ml you have gotten is supposed to be for what? According to this drug, for 4 liters of water, 1:4. 4 liters of water, as small as this. You don't need to empty everything. The issue of using spoon to measure, using the cap to measure without any specific measurement, without knowing how many ml is in this cap, is a wrong practice. Please, if you are using water soluble, you are using liquid medication, get a syringe and measure properly. Get a syringe. There are bigger syringes that can help you measure even 10 ml at once. Get a syringe, you measure it, you pour it into your water, then you cover your medication back and keep it in a cool, safe place. This medication will tell you how long you are supposed to how long you are supposed to administer it. Now, let's go to our water-soluble powders, sachet drugs. You see how I saved this? I've opened this before. After opening a drug, you close it, close the wrap properly, and peg it down so that air does not get into it. Moisture does not get into it. This is the best way to preserve your drugs. Now, if you take this drug, this is coccinol. Coccinol is for prevention and treatment of coccidiosis. If you go to the back where it is written, I said you always find it written here. At the back, it says for prevention, dissolve 1 gram in 4 liters of drinking water. And for treatment, dissolve 100 gram sachet in 200 liters of water, or 1 gram in 2 liters of water. Clearly stated, 1 gram in 2 liters of water for treatment. If it is for prevention, 1 gram in 4 liters of water. Now, it explains how to administer it. Give medicated water for 3 consecutive days. Plain water for 2 consecutive days, followed by medicated water for another 3 consecutive days. So it takes a 3-2-3 schedule. 3 days of these drugs only, from morning till night. For those 3 days, they are taking only this drug in their water. After that, you give them 2 days of plain water only, just plain water, ordinary water. Then the next 3 days, you repeat this drug. That is how to battle coccidiosis, especially for treatment. Now, for prevention, by giving your birds this drug at the right time, you can give the first 3 days. The first 3 days, you give them for prevention. And then you wait for about a week and a half, and then repeat it again another 3 days. Because the birds are not down with the disease yet, you are just preventing. Hope this is clear. All right. Now, to get this drug, you make use of our scale to measure. That is why it's important to have a scale. Many people are using spoon. Many farmers are using spoon. How many spoons in 4 liters of drinking water? I can't tell you how many spoons because the measurement is in grams. So for your drugs, if you want to measure, let's say you are distributing 10 liters of water for your birds in the morning, and you are trying to treat coccidiosis. So you are using 1 gram in 2 liters of water. So if you have 1 gram in 2 liters of water, it means that you need 5 grams in 10 liters, 1 gram for every 2 liters. So you will use 5 grams in 10 liters of water. I hope that is clear. Now, to administer your water-soluble powder sachet drugs, look at the dosage. You have birds and you have to mix 10 liters of water for them that day in the morning, 10 liters of water. Now, if you are treating coccidiosis, you say it is 1 gram in 2 liters of water, 1 gram in 2 liters. So it means 2 grams is in 4 liters of water. It means your 5 grams is what you need for 10 liters of water. Hope that arithmetic is clear. So you'll be measuring 5 grams and mixing it into 10 liters of water. Now, you need to get a piece of paper. This is what I do. I get a plain sheet because the grammage is quite small and it's not a large quantity. If it is a large quantity of water you are getting, you can just measure the weight of this drug as it is like this. Then get a small container and little by little pour out the quantity you think could be adequate. Or get a spoon. A spoon is not right for you except it's sterile. Otherwise, you shouldn't fix a spoon inside. So just turn it out and then remeasure again. You will know the difference. It will tell you if you have gotten up to the quantity you intend to measure. But if you have not gotten, you are using a very small dosage, like 5 grams. 5 grams is quite small. What I do is to get a piece of paper. I'll get a piece of paper, place it on my scale. My scale is on, place it and take it back to 0. My scale is on 0. Now I can put my drugs at the center. I keep putting my drugs at the center until it reads 5 grams. Once it reads 5 grams, I pick up my paper and pour this into the water. It's as simple as that. If your spoon is not sterile, please don't put it into the drop to fetch. I hope that's clear. Once you are done with that, you seal your medication, keep it in a cool, dry place. So that is how to administer both water-soluble powder and liquid medication for your chicks. Now, we've spoken about the chart, so I know that you are clear about that. I hope this has been helpful. Thank you. See you on the next teaching. Thank you.